Welcome to the Melinda Eitzen Show. I'm Melinda. We're so fortunate today. We have Barbara Neal and Chad Collom with us to talk about mental health. Because guess what? We all need good mental health. And in divorces, we particularly need people to manage their mental health. Welcome.
Thank you, Melinda. Thanks for having us.
So glad to have you.
Thank you. Thank you for having us.
So one thing in the mental health world is there's a lot of different types of credential, right? So Barbara, tell the audience, what is your credential?
Okay, I'm licensed professional counselor and licensed marriage and family therapist. I've had years of training with life coaching, and I've also had, of course, the collaborative training that I did some with you. But primarily mine is my two basic licensures, the LPC.
And what do you like to do or see? What type of people do you like to help?
I really prefer couples therapy. I think it's challenging. You have to keep up with so much, and you have to think quicker on your feet. I just like it a lot. I do a lot of individual. I, in the past, worked with a lot of teens, but I don't get that many teens now. But when I do, I still have I feel like I bond well with teenagers. But couples primarily, probably 50-50 with individuals and couples.
I got it. Okay, Chad, what's your credential?
I psychiatric mental health nurse practitioner. I have my doctorate in nursing practice.
Oh.
So I was an RN, then the psychiatric mental health nurse practitioner, then the doctorate in nursing practice. Yeah. So
Overachiever is what that sounds like.
Yeah, a beating.
A lot on a card.
Yes.
And not all mental health professionals can prescribe medication.
Right.
So are you one that can?
I can.
Oh, that's
yes,
excellent.
As a nurse practitioner, I can.
And the other group that would be is psychiatrist.
Psychiatrists, MDs, DOs, physician assistants. And in Texas, I have to have a collaborating physician. So an MD or DO.
I see. And a MD stands for medical doctor.
Right.
And some medical doctors, I've seen people's just general physician prescribe them mental health medication.
Oh, yeah.
And I'm always like, are you seeing a mental health professional?
Yeah.
I would recommend that they see a mental health professional and not just get their medication from their medical doctor.
That happens a lot, and Chad and I note that, because when I'll get a client and they put in their paperwork, if they're on a medication, psychiatric medication, I'll ask them, and I would say more times than not, it's been a family physician or someone I've gone to for years, which indicates that it's more like a high blood pressure medicine to some people. It's like, I got this prescription, I'm taking it, but I'm unclear as to what it really is supposed to be doing.
So sometimes the two of you work together to help a patient.
Oh, yes.
All the time. Probably 25 plus years.
Yes.
So far?
Yeah.
Yeah.
And so tell me why. How does that happen?
Do you want to take that?
Okay.
First?
Well, it can go from either end, actually, from either Chad or myself. Usually when I get clients that have been on a medication for a while, and they don't know if it's working, their behaviors seem to be consistent with what it was prior to the medicine, I ask them to have it reviewed. Just get with a psychiatrist, or I recommend Chad typically because he's a good listener and smart with it.
Oh, thanks.
Well, you are. And so I do it from that point of view. Some other times they've not taken a medicine, and they'll come in and say, I don't want a medicine. I just want to be upfront with that. And I say, okay. But yet they have some things that are going on they're having a lot of problem with. So I'm very cognitive, behaviorally oriented, and solution focused. And for me, what that means is I check and see some of their primary ways of thinking that are setting them up. To do some behaviors that just frankly don't work. So I try to work on some of that. If we don't make progress, if it seems like we just keep hitting brick walls, the anxiety's too high or the mood's too low, I will definitely recommend to Chad that he may take a look and see if their medication might be helpful.
And that's what I love about working with Barbara is, for one, the solution-oriented focus. And if she's sending somebody to me, she's because she's like, she thinks they need to be on something. It could be mainly temporary most of the time, or just a reevaluation of that medication. And that's what I love about it. So when the patient who has never been on medication before, we kind of finesse it and just say, she starts on her end, or vice versa, and they'll come in, they finally made that appointment and they're telling me, I just don't want to do this, but Barbara thought this might be helpful. So they already have that kind of, she's setting that up for them to feel more comfortable to even talk about it. And so, we'll talk, and the first question that's always there, do I have to be on this forever?
Right.
And I always say, no, look what's going on around in your life. This is something temporary, but, I always say the medication, it can be like giving you breathing room, and you'll get so much more out of your therapy with Barbara to bring those tools out from that, you're in that session, but when you get into the world, you're like, oh God, what were those tools? Because the anxiety kicks up, the depression's so bad, where that can help alleviate that.
So what type of medications are you typically prescribing?
I love seeing the patients. I see adults, and I love to see adult ADD, anxiety, depression. That's mostly what I see. I do have some bipolar, a couple schizophrenia, but I prescribe a lot of like ADD meds, a lot of antidepressants, which many are approved for anxiety, ruminations, those kinds of things. So, and some mood stabilizers, obviously, for bipolar and different whatever. And, you just got to get that history.
Yes.
And see what's going on.
History.
That's the important thing. You need to be able to spend that time and to really get the history, and that's where it's great working with that collaboration with Barbara. Because you get more, she gets so much more out of her sessions and info, and we can just work together for that team they have. Yeah.
And you said it could be temporary because it could be a situational
Sure.
Yes.
depression. As a divorce lawyer, I certainly see people situationally depressed and anxious. And divorce is one of the major life changes. And I always recommend that they be in individual counseling while we're going through this. And they, some people already are, hooray. And then some people say, well, I'm not crazy. Well, what do you say to someone who thinks you only go to a mental health professional if you're crazy?
Right.
Well, I do hear that too. I know you probably do
I hear it
too.
all the time.
But the way I like to handle that is much depression that's situational in my experience, with some really good therapy and looking at it, being able to process what the feelings are, work through them, maybe do some things, look at things a little bit differently. I find that the mood really more times than not can get better and without any medicine. I find it harder if they have a real high anxiety issue. That causes the rumination, some kind of compulsive behaviors.
It's hard to get out of that loop.
It's hard, Chad.
So, yeah.
And so that's especially when I feel like I need someone like Chad to help with that, so we can progress with some behavioral changes. But they're not crazy. I don't know where that phrase comes from that Chad and I hear so much. I think it's kind of an aside, kind of a almost tongue-in-cheek.
It seems old-fashioned to me.
Oh,
Well, it's
yeah,
right?
for sure.
tongue-in-cheek. Mhm.
Like,
Yeah.
it seems like in this day and age, I'm surprised that more people don't realize everybody needs a tool in their tool belt, right?
Yes.
And
Yes.
the tool in their tool belt is going to be occasionally, I might need to go see a counselor, or I might need to be on a little medication, or I might need some life coaching.
I see that so much more. I don't know about where Chad does or not, but that people will say, I'll ask, why are you here? What do you need me to help you with? And sometimes they'll just tell me, I value counseling. I've been off and on in counseling all my life, and I value it, and I just need a tune-up or a checkup. I've gotten that more in the last 10 years. My first years in practice, you wouldn't have heard that.
Yes. So we're getting a little bit more modern thought, maybe.
Yes.
We are.
You
I
see
see
that,
that
Jeff?
too, where there's more of, family members are actually talking to each other about it now. And patients come in, found out all this stuff my grandmother shared with me or my mother shared with me, and everything started kind of making sense about my childhood, and just finding out for the first time that they were taking something that was helpful to them, and so they came forward to go, you know what, I think, because I identify with so many of these patterns, I think let's look at something, and it really opens that up. So it's great to see, and there's so many cultures, that don't talk about mental health. I feel like I'm seeing that open up more, and to throw TikTok in there, I hear that all the time.
Really?
All the time of so many people come in to get an assessment for depression, ADD, anxiety, because they've been watching TikTok. I'm not on
Interesting. I've never
TikTok,
heard of
but
that,
I'm like,
Chad.
you haven't? Oh
No.
gosh, it's fascinating. And I'm like, well, who are you watching on TikTok? And I'm not even on TikTok. But and I'm like, make sure it's legit, but there's a lot of legit providers and mental health people on TikTok that are really giving really
I see.
good
didn't realize
information.
that.
I didn't either. I thought TikTok people were doing dance
Dancing.
moves.
I did too.
So did
can't help it.
I did too. But I was like, what?
It's a
Okay.
broader
Interesting.
platform,
Yeah.
apparently.
Yeah.
Must be. We're limited.
Is the medication about brain chemistry, that it's helping to adjust your brain chemistry?
That's theorized. I mean, but it's when you see someone that, especially when, some of my, and you've seen this too, some of my patients that are bipolar are with schizophrenia, and you see that they get on a medication and it starts to work, and just the drastic difference, the change it's made, you're like, yeah, there's chemistry there for sure.
Yes.
Of course, yes, there's going to be, environment, upbringing, all that stuff. It just all goes together, so, but yeah, and I hate the term, and I think we've all tried to get a chemical imbalance. We've tried to get away from that.
Oh, I see.
Yeah, that's
Well,
something.
the two things people come in and tell me their spouse is narcissist. They all say they're narcissist, and bipolar,
And borderline.
Yes.
and borderline.
You'll hear that everybody wants to put that on everybody.
It's amazing to me how they'll say that. I had one client that she was so convinced her husband was narcissistic. She did the deepest dive, Chad, into read everything she could about narcissism. I mean, she was a walking encyclopedia. And so she comes in, and I had worked with her husband as well. And she says, I think when he does this, that he is being his narcissistic self. I said, well, I don't know. It just sounds like maybe he's just doing X. So we see a lot of people doing deep dives in those, don't we, Joe?
Oh yeah, for sure. I mean, we could all get a label of narcissism.
Yeah.
That's what I was just thinking.
We all have little
If there's
bits
7
of those.
traits in the DM,
Oh, yeah.
like we all have some of them,
Yes,
right?
we do.
Because
Yeah,
it just
totally.
starts with self-interest, and that's survival, right? We have to be self-interested to some extent.
And assertive. That's what kind of goes hand in hand.
And then you throw a real nasty divorce on top of that. Then it's like,
Yes.
oh yeah, okay, that's it. You're a narcissist.
When sometimes I'll have someone come in and say, well, he or she's bipolar, so they can't possibly parent the children. And in my experience, if somebody is working with medication and counseling, it doesn't matter. Bipolar is very manageable.
Oh,
Is that been your
absolutely.
experience?
Yes, very much.
Very much.
Yeah.
Now, borderline personality disorder, I think the key for me, and I don't know, I'll ask Chad, but is if they acknowledge that's something they struggle with. Because if they can see that, then some of the cues, some of the check-in of thinking can be helpful. It's when someone doesn't accept that maybe that's what's going on.
That's my I'm not a mental health professional, but my way of determining if somebody has a serious mental health disorder is if they have no self-reflection.
Absolutely.
So I will ask
Yeah.
them, what was your part to play in the failure of your marriage? And when they say nothing, like, uh-oh.
Yeah.
That's true, Melinda.
Yeah.
Do you see that too if they don't accept
Oh,
the diagnosis?
absolutely. I mean, like with the personality disorders, obviously, true narcissist. That's like if they think there is nothing wrong with them, they've done nothing. That's tough. But that's all I'll say. But the borderline, when I have patients that do have an actual diagnosed borderline personality disorder from psychologists and testing, who come in, and they're so in tune, and they've done so much like dialectical behavioral therapy. DBT is a great, where the
Yes.
emotional regulation is there. And like you said, they go, I have this.
Yeah.
This is what I've been working on. Medications for that, really, for me, the medication would be more like something that could help with some impulsivity or the emotional dysregulation. It's just a lot of the therapy and the admitting
It's just
that there's
crucial.
something going on.
Yeah. Chad mentioned earlier about treating attention deficit
Yes.
disorder in adults. I don't know if you see it, Chad, but within the last 10 or 15 years, that has kind of been a trend. And when I try to talk to them about it, I'll say, well, did you have any issues in school when you were growing up? No, not really. And they've gone through college, maybe even a graduate program. Chad, do you see that? And then how did they do all that if they had an attention issue?
Well, I can tell you from experience. No, because you find ways of compensating. Say, for a great example, when in college, you might have spent hours and hours more studying where other people were spending maybe a couple of hours, or you're cramming. You're, last minute cramming, because that kicks in that dopamine, norepinephrine, in adrenaline. And so you're scared and freaking out. So there's that whole thing, but it's like, so, and they're like, I had to spend so much more time doing this and still barely passed, and so there's those ways, they find ways compensating. I noticed that I always ask people, going back into childhood and stuff, when they're like, no, I did really well. I want to find out too, what their, did they grow up with a lot of structure, like from the parents? Because that's one thing. And then when they go out on their own and say they go to college or wherever, that's where they're like, what is going on? Things aren't done for me. It's like the structure. And they're like, what is happening? And they're like, something's not right. I can't figure out what is going on.
I had a case recently with ADD, maybe ADHD, but it was a child, but an older child. And I learned a lot in that case about it that I didn't understand. I thought it was just you're distracted easily. But this child had a very hard time transitioning.
Yeah.
That's
Huge problem. And he would get hyper focused on one thing. So, for example, he had horrible time getting to school because he couldn't get his hair right. So he'd be hyper focused on that. Then he would be running late, but then he did not want to walk in the building late. And so they would not be able to get him out of the vehicle into the school building. This was like an ongoing problem, huge problem. And so one parent's getting criticized because you can't get the kid to school, but it wasn't like a regular situation. And I felt so bad for everyone involved because it was just something that everybody else, it's not a big deal. It's a huge deal for this kid to just walk in the school building on time.
Yeah.
Huge. One thing I think is not emphasized enough is the impact on attention deficit disorder in a relationship.
Oh, big time.
There are books now that are helpful on that, but when I first started out, 30 years or so ago, we didn't talk about how it affects relationships. We were more versed on, with the individual. But it can be quite significant issue with relationships.
Oh, I imagine.
Do you see that, Chad?
Oh, absolutely. I did all my doctoral work on adult ADD, and this was in
I
this
didn't
was in
realize that.
2007, 8, and so it was really starting to turn the corner because it was always the myth was, oh, when you turn 18, it goes away.
Yes.
Oh my God!
Because it's magic.
Yeah, it's magic. Yeah. And so, but the problem is, and there's so much evidence-based research out there with the high rates of divorce, high rates where you're talking about the relationships, high rates of substance abuse, addiction, not being treated, job loss, constant, all of that. It's like massive things, the impairment it can cause into adulthood. So
Well, think
fascinating.
about, my example, that was disrupting that whole family
Absolutely.
every morning and causing conflict between the husband and wife who were divorced.
Yeah.
Of course.
So, I can imagine in an adult relationship, if you don't understand why your spouse can't get out the door on time to do something, or whatever it is, they're stuck.
They're like, we
It's
talked
maddening.
about that. Oh, no, we didn't. It's like the communication part.
Or just they'll say, my partner doesn't listen. I can talk and talk, and then they never know what I've said. And that seems like it could be easily corrected, but that can be chronic, and you end up feeling lonely in your relationship because you don't feel like that you're getting listened to.
And they don't realize it's actually a disorder that could be treated.
Yes.
Easily.
Yeah.
Yeah.
It's not just a conscious effort to ignore a partner, usually.
Right.
Sometimes I guess it is.
And there is a big stigma of getting treated because of stimulants or
Yes.
the main and
Yes.
so it and so many people say it's like, and granted, you have to be careful, but you hear the word Adderall, and a lot of people get this like whole negative connotation, or there's when you have ADD and you're treated and you're diagnosed correctly, and it's like they calm down, you're focused, it changes everything.
It's a relief.
Yeah.
But Chad, do you think sometimes the Adderall is overused or misused by adults?
Oh yeah, for sure.
And that's
yeah.
that
when you
way-
can find it.
Yeah,
There's been a shortage for a long time.
Yeah. But I've wondered about that, and I've seen some of that. Actually, I've had a couple of clients that went into rehab for Adderall addiction.
I think that it can be attractive to people because they think it makes them lose weight,
Right.
but it also makes them stomp around and angry if they don't really need it.
Oh, yes.
Absolutely.
That anger component is very damaging in
Yeah.
a relationship, too.
So medication management is important.
Oh.
Like, don't take the wrong
And
medication.
proper diagnosis.
Yes, good
Yes.
point. And managing the medication.
Yes.
That's, what is it, Chad? If you're in a psychiatric medicine, in there, what is that, 3 months?
If someone's been stable a long time, the longest I'll go is every 3 months
3 months.
for appointments. If they've been stable for a while, and I've known that have that history with them. So
Because you need to know what's going on.
absolutely.
What if they're not aware of what's going on? Like, do they need a family member to be giving some feedback on you're stomping around and angry?
Usually in therapy, interesting, Melinda, you can ask enough, talk enough that it can become pretty evident without just saying, do you have a hard time focusing?
Yes.
And then it kind of dawns on the client, well, yeah, I do that too, or I have to have music when I work. Just some of the characteristics that they wouldn't have maybe associated with that.
And that's what's great. Like Barbara has reached out to me before and go, when she comes or he or she comes in again, maybe I've talked to him about it already, that possibly there might be some ADD issues there. And the patient's like, I don't know, I don't think so. But you're seeing this after
Yeah.
working with them for so long, where they come in and we discuss it further, and it could be, so that's nice to have that
Yes. And
And
collaboration.
Chad might have not gotten it because they didn't speak about some of
Yeah.
these behaviors.
Are they, it's so common to have that anxiety,
Anxiety.
depression, all that together. And then so many times ADD not treated can look like depression or anxiety, vice versa, and so we were so focused on the mood because you really want to get the mood controlled first, that wasn't on the radar.
So it's important to hang in there. Like, let's say somebody comes in and at first they try therapy or they try a medication and it doesn't work immediately. It might take a little work to get it exactly right.
A lot. Sure.
The medicine especially, and then honestly, sometimes the approach a therapist use, me included, of course, just isn't the approach that might work for that client. And they may need a different approach. I don't like to beat something to death. If it's just not seeming to be helpful, I'd like to see them try something else.
And y'all are both, in my opinion, high skilled, excellent. But not all therapists are created equal, just like not all lawyers are created equal. Like we have good people in our profession and not so good people.
Sure.
So if they try therapy and they're like, this isn't helping at all, maybe they just need to try another therapist.
Absolutely.
Yep.
don't just abandon the whole concept because
Well,
their experience wasn't good.
That is a great.
It's a good
Thank
point.
you for that.
Because
Yeah.
they'll say to me sometimes, yeah, I went to this therapist, but, it didn't help. And I actually dig in deeper with that. I'll say, help me understand what about your therapy then wasn't helpful. And a lot of times it's the client and not so much the therapist. And I need to know that. I need to know because, I don't want to be in the same bucket with that.
Oh, when it's very common in divorce world to change lawyers. I take
Yes.
over a lot of work from other lawyers, and sometimes it's warranted because I can see that
Yes.
what they did wasn't proper, or maybe they were overwhelmed with work and they didn't give it proper attention. And so I'm thinking, okay, but I'm the same way. I'm like, why didn't you like that lawyer?
Yes.
That's important information.
Because there's no point just repeating that over and over, right? If it's really
absolutely.
them and not the lawyer. And if it's a lawyer I know and respect, I'm like, what's going on? But both my type of representation and your involvement with people, it's very personal.
Yes.
Yes.
They're having to tell us things that they may have never told anybody.
Absolutely.
Right.
So there has to be a good connection. Don't you agree?
A
Oh,
trust.
for sure. Yeah.
And if they don't feel that, like, move on.
But Chad, that's amazing to me how can't recall a time that anyone came back to me that I had referred to him and said, no, that doesn't work. They say things like, I love him, and he really
sweet.
listens. He is so good. He works with me well. I mean, 100% of the time. And I think that's unique.
Over 20 years.
Well, and I've worked with a lot of doctors over the years, and Chad just seems to have a connection that they trust him very quickly. It's a talent,
Thank you.
Chad.
Thank you. Well, back at you. I mean, it's like same thing. But it's, and to me, I don't know, it just seems you listen and they
listening.
feel heard. And I've had so many patients tell me, okay, you remembered that. And I'm like,
Yes.
and I'm like, yeah, well, it's one of the main reasons you're in here. That's what I'm thinking in my head. So I should remember. But things like that,
Yes.
it's like, and when they come in, I know I do medication management, but I like to also incorporate as much supportive therapy as I can.
And that's
Uniquely,
unusual.
Yeah.
That's
That's
unusual.
very unique in him and they'll tell me that. He listens rather than just saying, is the medicine working? What's been going on? Are you still having issues with X? Anything unexpected? He asks enough questions to know if it's more than just the medicine.
Now, since COVID, mental health is even more available because we're all Zooming.
Yeah.
Exactly, yes.
So if somebody, we can easily put up roadblocks. And if their roadblock is, I don't want to drive that far, I don't know where the parking is, they don't have to have those roadblocks.
No, it's provided where people can do it at lunch.
Yep.
They can go to their automobile and do a session at lunch or go to a private room. And before it took 2 hours, 30
Yes.
minutes to get to an office, 30 to get back.
And in
then,
Dallas, with the
Easy.
traffic and
It's 30 minutes no matter where you're
There
going.
you go, yeah.
I mean, during the worst parts of COVID, when we were all trying to figure it out, I have a lot of nurses and medical professionals I see, and many of them were working on COVID floors, and they would be in their gear, and they would duck into a room and do their appointment with me, and I was just like, wow, it's like that, and it just started. Then we started really seeing, wow, you can do this, and I mean, my no-show rate has gone to almost zero. It's like
Mine
'cause
too,
people,
Chad.
because people can,
amazing.
life happens and people have to cancel last minute or they forget and don't show up. But with the telemed, they're like, I'm going to step out of my office, go to a conference room or bathroom, whatever, somewhere private.
Yes.
It's pretty cool to see that change.
So no excuses.
Yeah.
It's made a big difference. The teletherapy and has made a huge difference, I think, in all of our ability to see and help more people, really.
I'm going to put on the screen how people can reach you.
Okay.
So that they can find you, and I would highly recommend both of you.
thank
you.
And if you're not a fit, you'll tell them, right? And you'll recommend
Absolutely.
Oh, for sure.
another
Yeah.
path.
Yeah.
Thank you both so much for being here.
Thank you,
you for
Melinda,
having us.
very
It's been a
much.
pleasure.
I enjoyed it.
Thank you.
It's good to see you.
Thank you for watching the Melinda Eitzen Show, and we'll see you next time.